I'm Melita from Move Mountains Physio. A little while ago we had a request to do a video about hip labral tears. So the labrum of the hip is a thin piece of cartilage which lines the socket of the ball and socket joint of your hip. Labral tears are not uncommon, but they do not happen spontaneously. If you've got a labral tear, it is indicative that that hip has been unhappy for a while. Unhappy in that there's been an imbalance in the muscle forces around it, which means that the hip joint is not staying centered in the middle of the socket as you move. If you've got hip muscle dysfunction, given long enough, the labrum can start to wear because of the abnormal forces that are going through it as you move the bones of your hip. Hip dysfunction and labral tears can be caused by lots of different problematic biomechanics, but a couple of the most common that we see is belly gripping and bum gripping. Now, belly grippers are those people who turn on their core 24/7. Often they think they're doing a good thing. They'll be standing, sucking in their belly, sitting, sucking in their belly. If this is you, you're probably doing it because you think you're doing yourself a favour, trying to make yourself nice and strong. The problem is, this is not actually the way our body is designed to work. And if you're gripping, holding onto your belly muscle, I can guarantee they are not your core muscles. If this is you, go and have a look at our video on the difference between the core and the abs, because this is really important. Bum grippers are people who squeeze their glutes 24/7. Again, it's something that they start to do because they think they're doing themselves a favour. Or it can be it's a cue that they use in the gym and then they don't actually realise that they're continuing to do it throughout their life. Just like our belly muscles, our bum muscles are not designed to be turned on 24/7. If you check in with yourself right now and you feel like you can relax your bum muscles, it means that you're a little bit of a bum gripper. Go and check out our video, Stop Squeezing the Glutes, because again, this is really important to restore that normal function of your hip and pelvis. So the question that everybody wants to know with labral tears is what exercises are going to fix the problem? And exercises do help labral tears. In some instances, you may require some surgery, but if that labral tear has occurred because the hip is not functioning as well, then exercise is exactly what you need to heal it. And it's nothing fancy. Squats, lunges, bridges, all your normal stuff are really useful for fixing a labral tear. But the important thing that is relevant to everyone is that if you have a labral tear because of the way that you move normally, then continuing to do those exercises the way that you move normally is not going to fix your labral tear. If there's an imbalance in those hip muscles, which has created the problem, you need to figure out where it's coming from. Change your problematic biomechanics, change how you move if you want any kind of change in that labrum. If you have any questions or want any tips on how we think you should be doing squats, bridges, all those standard exercises, go and check out our videos on YouTube.